today, tonight, to make certain that folks who are on the Affordable Care Act will continue to have access to health care. It's up to us to solve that problem. And let me just talk specifically about that and what it means to folks. If we don't act, Mr. President, in Florida, 30% increase. Kentucky, 32% increase. Louisiana, 32% increase. Alabama, 34% increase. West Virginia, 35% increase. Texas, 39%. Tennessee, 41%. South Carolina, 50%. And you know, we have wicked high health care premiums in Vermont, and we may have the worst situation. Let me give you an example, and I know you, Mr. President, as a former governor, are totally sensitive to this. I know you are. A family where you've got two folks working, they're making a little over $100,000, they can get the Obamacare health care for about $7,500. Their premium is going to increase by $23,000. That's not their fault. They have no control over that. They can't shop around. But what they know is they have a child, maybe a child with disabilities. And what they know is they love that child. They know they love their family. And they know as responsible adults, they want to make sure if those kids, if their partner needs health care, they'll have it. And if we fail to act, we're saying, you're on your own. It's complicated. It's political. That is so unacceptable. And that's what we're talking about. The blame game is, why are you in favor of a shutdown? I am not in favor of a shutdown. I think the more profound question for each of us, Republican, Democrat, Independent, is it within your power to continue health care for the Americans that we represent? And the answer to that, we all know, is a yes. It is within our power. Now, we may have to stand up to an executive who doesn't particularly care about that. But we do. We do. And if we do, we must act. So that's what's at stake here, Mr. President. Will we step back from the politics and the blame game and the shutdown, showdown activities that are becoming ever more prominent here, and just ask ourselves, as United States senators, all of us whom represent people who are working class, some are wealthy, some are disabled, all kinds of people, and we care about them. But can we really say we care about them if we'll let them lose their health care? My answer to that is no. So I'm ready to do whatever it takes to continue access to health care. And the people who want health care, it's about the love they have for the people in their lives. It's not about getting some political advantage with the outcome of this debate. Mr. President, I yield back.
Mr. President.
Senator from Hawaii.
Thank you, Mr. President. Donald Trump is powerful, but he is not all powerful. It is true that he's trying to consolidate power in illegal and dangerous ways, but it is also true that he's often failing to do that because of public opinion, because of markets, because of institutions, and because of the law itself. And I want to give you a couple of recent examples. 2 weeks ago, shortly after Trump and FCC Commissioner Brendan Carr threatened to punish ABC if it didn't suspend Jimmy Kimmel's show, the network announced that it was taking the show off the air indefinitely. And so, at first, the public coercion seemed to work. Brendan Carr had said point blank, we can do this the easy way, or we can do this the hard way. And the network caved. But a swift and searing backlash quickly followed. Consumers revolted. People began canceling their subscriptions. Disney's market cap fell by close to $6.5 billion in a matter of days. Artists, advertisers, and employers spoke out. Even Republicans in the Senate denounced the move. My Senate colleague Ted Cruz called it, quote, dangerous as hell. I think it is unbelievably dangerous for government to put itself in the position of saying we're going to decide what speech we like and what speech we don't, and we're going to threaten to take you off the air if we don't like what you're saying, end quote. Criticizing your own party's administration is hard. I understand that. But this is not about whether you're left or right or whether you thought Jimmy Kimmel's comment was insensitive or not. It is about the basic question of, are we allowed to speak freely in a country without fear that the government is going to come after us? Because if not, that's not the America that any of us recognize. Here's another example. Last week, Trump installed a loyalist with no experience as a prosecutor as the interim U.S. Attorney for the Eastern District of Virginia, and within days, the office indicted former FBI Director James Comey on charges without much evidence at all. And the case is so absurd that they couldn't even get a single career prosecutor to take it on. And so instead, the newly installed interim U.S. Attorney had to sign and present the indictment herself in a highly unusual move. One of the charges was rejected by the grand jury almost immediately. Now, why does that matter? It is without a doubt a dark day for the country when the President of the United States uses the Justice Department to prosecute political opponents. But legal experts widely expect this case to fail before it even gets to trial. And that, too, will be a reminder that while this president is powerful, he is not all-powerful. This isn't a free-for-all. He doesn't get to just do whatever he wants. Which brings me to this debate about government funding. Democrats are out of power, but we are not powerless. And our price is not that high. We have been asking Republicans for over a month to sit down and negotiate. I've been here 13 and a half years. We have never passed an appropriations bill without a negotiation. But Trump literally told his party, quote, don't even bother dealing with them. And so it took until today, on the eve of a shutdown, for a meeting, and the House is out of town. The House adjourned until after the funding deadline expires. They were going to come back on October 1st, which is already 24 hours too late. Now they're thinking October 7th. If you're serious about a deal, if you're serious about keeping the government open, why are you not in the United States Capitol? Russ Vought, in July, the OMB director, said, you know, the appropriations process should be less bipartisan. The person in charge of the federal government and the executive branch is pretty explicit. He says the appropriations process should not involve Democrats at all. The only way to keep the government open is for both parties to negotiate a bipartisan agreement. If the Republicans want to listen to Donald Trump and say, don't even bother dealing with the Democrats, then there's a very old adage and an iron law in politics, which is, if you don't ask for the vote, you do not get the vote. We are ready to work together to keep this government open, and I want everybody to understand what we're fighting for. What we're fighting for. Tens of millions of Americans are getting letters in the mail, and they don't know they're on the Affordable Care Act exchange. What the hell is that anyway? They just sign up for health care on a website, right? You don't know if you're on Obamacare or some hybrid thing or employer or this or that. You just get a letter from your insurer, and they say, if you want to re-enroll in your health care plan, here's how much it'll be. And it's usually like a small increase year over year to cover inflation. And so now they're going to get a letter that literally says, your subsidies are gone and your new price is X. The average increase is going to be hundreds of dollars per person per month. Add to that we are hearing in some states, and maybe as a result of some jawboning with the administration, they are waiting to send those letters. They are waiting to send those letters. Why? Because they're hoping we're going to resolve this ACA tax credit thing. And they don't want to eat, politically speaking, the fact that a bunch of people, tens of millions of people, Democrats, Republicans, independents, non-voters, but zero non-citizens, you are not eligible to be on the exchange if you are a non-citizen, are going to get a letter saying, you know, it's going to be $3,000 or $4,000 more per year. Like, go talk to a regular person. Some of us know regular people who are on that exchange and know, I just can't do it. $300 more per month. And by the way, if you get that letter in December and your first payment is due on January 1, you are extra screwed. And so I understand that the White House understands how big of a political liability this is, because people are really going to get hurt. And now it's a question of sort of people wanting to not behave as though they're giving in. But let's be adults here. There is a crisis that is about to happen to tens of millions of Americans, and we have an opportunity to fix it, and there is bipartisan desire to fix it. And Leader Thune and Speaker Johnson's view is, nah, we'll deal with that later. And Donald Trump was saying, why don't we deal with that next year? By next year, all of the rates are locked in, and people will be paying $300 or $400 or $500 more per person per month. We can fix this, and we should. I yield the floor.
I recognize the senator from Minnesota.
Mr. President, I come to the floor today because we have a choice here. And the Democratic leaders in both the Senate and the House just went to the White House. They had a long meeting. I'm glad that meeting happened. I hope something will come out of it. But the president has repeatedly said, well, we don't need Democratic votes. Well, we can do this on our own. And the problem is, the more he says that, the more the American people are saying, what about me? What about me, says the farmer whose soybean market has dried up that I met with last week. What about me, says the mom coming out of the grocery store and looking at her bill. Or the student thinking, I can't afford this electricity bill. Or everyone that's starting to look at these healthcare numbers, looking at the insurance premiums, looking at the fact that this administration has not stood up for them on healthcare. So if they would open their eyes right now and see what's going on out there, or maybe go to those 13 rural counties that I just visited in Minnesota, maybe they would see that this is a moment where people are expecting the president and congressional Republicans to work with us on these unfolding crises. The tariffs may be decided in the courts, or the Congress can decide enough is enough. But this healthcare crisis, that's on this body to do something right now. The president has sadly made his position clear. He would rather shut down the government than work with congressional Democrats to address this skyrocketing healthcare cost crisis. So our colleagues, many of whom I work with every day, they can decide. Are they going to rubber stamp what he does? Are they going to try to work with us? So one of the things one of the farmers said to me last week at one of my meetings is, he said, between my entire market drying up, Minnesota, 60% of our soybeans are exported to other countries. Of course, China hasn't purchased a bushel since this president came in. And the cost of fertilizer going up because of the tariffs on potash out of Canada. And even then, although they were reduced, it's still a major driver. between the issues with visas and not having enough workers, he described it as he looked at the healthcare policy and what's happening there, since about 28% of our farmers are on the Affordable Care Act because they're individual business owners. He said it's a perfect storm of ugly. And I think that's a good way to describe it. So what do you do when there's a storm, a perfect storm of ugly coming at you? Do you go out there with an umbrella and say, well, maybe we can look at this in a month or two? You don't have that luxury. The American people don't have that luxury. This is not a December thing. This is not a January thing. This is a now thing. So I hope our colleagues will see it as the opportunity that it is, and that is to finally do something to help the people that are facing this. NBC recently reported on one family that currently pays $278 a month for health insurance thanks to the healthcare tax credit. If Republicans in Congress and the president let this expire, this family's premiums could soar to $1,800 a month, increase of $1,500 a month. Estimate is nationally it'll be 75% increase in premiums. In rural, it'll be double. I was actually surprised in our rural hospitals. Of course, they're concerned about the Medicaid cuts, that $500 billion in Medicare cuts that is coming at them because of the fact that the debt was increased so much in that bill with the tax cuts for the wealthy that it triggered an automatic $500 billion in Medicare costs. All of that worries them. But maybe I just hadn't thought it through. The Affordable Care Act premium increases without any tax credits really concerns them. Why? Because so many of their people that are going into their hospitals in rural areas are either on Medicaid or they're on their, what we call in Minnesota, MNsure, their policy through the Affordable Care Act. Those people won't be able to afford double, no way, because they're already in that perfect storm of ugly. So then they're not going to have insurance, and they're going to show up in their emergency rooms in these mid-sized towns with no insurance. So they said this could make a major, major difference for them. Our legislation, it would have kept the lights on. Our bill, it got more votes than the Republican bill. Like to point that out. A whole bunch of people didn't even show up for the vote that we just had a week ago. And our proposal that did something about health care to restore people's health care actually got more votes than the Republican proposal. So we want people to work with us and prevent millions of Americans from losing their health care. This is our opportunity to show why we came here to begin with, and that is to stand up for our constituents. Thank you, Mr. President. I yield the floor.
Mr. President,
I recognize the senator from Wisconsin.
for the past 6 or so months, I've been crisscrossing the state of Wisconsin, listening to families, small business owners, parents, caregivers, doctors, nurses, and neighbors about what good, affordable health care means to them. And the overwhelming consensus, as you might expect, was that having health care you can rely on and afford means everything. I know this exact feeling. When I was just 9 years old, I had a very serious childhood illness, similar to spinal meningitis. That wasn't the exact diagnosis, but I was in the hospital for 3 months. And even though I was able to make a full recovery, my family was then not able to find any health insurance to cover me, not at any price, because I had been labeled as a child with a pre-existing health condition. You see, back then, insurance companies were under no obligation to cover people who had been sick or were sick. So people with pre-existing health conditions like diabetes or cancer diagnosis so often went uninsured. That kind of experience, being hospitalized for months and then not being able to get health insurance, it's not an experience that one forgets. So when we have these debates about healthcare policy, I know that it's not just a high-minded conceptual idea. It is real. The consequences are real, and the people behind the stories are real. And over the past few months, I've been able to hear those real stories. I heard stories from families who were sometimes unable to put into words what it would mean if their Medicaid were stripped away. I heard from Evan in Madison, Wisconsin. Evan is on Medicaid. We call it Badger Care in the state of Wisconsin. Evan has undergone 2 brain surgeries and subsequent radiation over the past 10 years to treat brain tumors. Thankfully, he has Medicaid to help cover this care. But his ability to stay healthy means that he needs medication. And he said, as he wrote me, without Medicaid, I won't be able to afford my medication that literally gives me the ability to go out and be a part of my community. I also heard from Ashley from De Pere, Wisconsin. She told me how Medicaid is essential for her 15-year-old daughter with disabilities. Medicaid has allowed her to modify her home so her daughter can safely get around, and also allowed the family to get a wheelchair-accessible van so her daughter can get to school and get to the doctor and just be a kid and experience the world. These are the Americans who are now living in fear that their Medicaid is on track to be terminated because my Republican colleagues jammed through a partisan bill that cuts Medicaid to the bone and will kick more than 10 million Americans off their health care. And as always, I would be remiss if I did not say that that was all in service to giving huge tax breaks to big profitable corporations and the ultra-wealthy. This is the damage that I'm hearing about from people I work for. And sadly, the stories from folks who are worried if their health care is on the line don't end up there. 24 million Americans get their health care from the Affordable Care Act. And they're waiting right now for that dreaded letter in the mail, letting them know that their premium costs are about to skyrocket. For the 22 million who receive enhanced premium tax credits, their costs will go up on average by 75%. 4 million of these Americans are going to get that letter and realize that they cannot afford health care at all anymore. This, of course, is because my Republican colleagues refused to pass our bill to extend the enhanced premium tax credits and make them permanent, which allow millions of Americans to get affordable health care through the ACA. I heard from some of those families and small business owners last week. They are just dreading what they're about to find out and what the future holds for them. Take Kim, who owns a bakery in the Fox Valley. Last week, she laid out how if Republicans refuse to extend these tax breaks, she's not only worried about how she will be able to afford her health care, but also that increased costs on the exchange will mean that employees may quit working for her to go work for a big company that offers insurance. And of course, she's worried that her customers will inevitably left with less in their pockets to come by and patronize her store. I also heard from Keith in Marathon County, who runs his own insurance business. He knows this issue inside out. And Keith laid out some staggering figures for me of what he is staring down. If Republicans don't join me in extending these premium tax credits and making them permanent, Keith's premiums will go from less than $740 per month to more than $2,300 per month just to get insurance for his family. That is a staggering increase. It is no exaggeration to say that the American people are staring down a healthcare crisis. We have a healthcare system in crisis. And I want to be clear that it is 100% manufactured by my Republican colleagues. But you know what? This is still avoidable. It's still avoidable. I am hearing my constituents sounding this alarm, and so I'm here to do the same. I got the memo that they don't want to have Medicaid gutted. They don't want to have their Affordable Care Act tax credits taken away. And they don't want their costs to skyrocket. And the people I work for have been crystal clear about what they expect and demand of Congress. Work together to lower costs and give them the opportunity for their hard work to let them save and to let them get ahead. So that's my position. We need to lower the cost of health care, not take it away from families. I simply refuse to just go along to get along, because the people I represent are truly struggling, and the solution is right in front of us. And that brings us to today. The path to keep the government open and stop health care costs from rising for millions is on the table. The whole idea of a shutdown is totally avoidable. If Republicans refuse to see what is right in front of them, then a shutdown is on them. And Wisconsinites will know exactly who to thank when they get that dreaded letter and their health care costs skyrocket, or they see it simply stripped away. Mr. President, I yield.
Mr. President.
Recognize the senator from Connecticut.
Mr. President, the House of Representatives is not coming back into session reportedly until next week. The government is shutting down tomorrow night, and the Republican House of Representatives isn't here. And they aren't coming back until the government has been shut down, reportedly for days. That tells you all you need to know about who is responsible for a potential shutdown of the government. Republicans care so little about funding the government that they aren't even showing up. President Trump doesn't care either. He boycotted even meeting with Democrats until 24 hours before the shutdown was to begin. He was watching golf or posting on social media, basically anything except trying to negotiate, to do the job of government. I wish Republicans were trying to keep the government open instead of trying to shut it down. But what I really want is for Republicans to open their eyes and see what is happening at an increasing pace to our democracy. What I want, what I think is necessary at this moment, is for any budget that we write to put the health of our democracy first. In fact, as I've watched the events of the past few weeks play out, with political enemies being systematically hunted by this administration, I think that we all have a moral obligation to only support a budget that at the very least puts the brakes on the president's lawlessness. Right now, our democracy is in grave peril. And there's no better example of this than the events that played out last week over the indictment of former FBI Director James Comey. The president has made it clear that he wants to put his political enemies in jail as retribution for the charges brought against him. He does not care about whether there are grounds for these charges. He just wants charges. And so he instructed Eric Siebert, the U.S. attorney in Virginia, a Republican, to bring charges against James Comey. But Siebert refused for a simple reason. There was no evidence that James Comey had done anything illegal. So Trump fired Siebert. He appointed his personal lawyer, who has never set foot in a courtroom, as the new U.S. attorney simply because he knew she would follow orders. Every career prosecutor in the office recommended she refuse to bring the charges, again, because there were no charges to be brought. But she did it anyways, as instructed. Not a single other lawyer in the office would sign the indictment, virtually unprecedented in a case like this. Trump cheered the indictment, and then he warned that there would be more charges brought against others that had vocally opposed his policies. And that's not all that happened in the last 2 weeks. Trump ordered the FCC to issue threats to TV stations that did not remove one of his primary late-night critics, Jimmy Kimmel, from the airwaves. He announced new military deployments to additional cities. He began a process to harass and arrest leaders of prominent political groups that oppose his presidency, threatening at least one funder of groups that oppose his policies, George Soros, with arrest simply for supporting opposition to Trump. Much of this, though not all of it, has happened in the wake of the brutal, horrific murder of conservative activist Charlie Kirk. His assassination was abhorrent. And it was and still is a moment for all of us to consider what we can do to stamp out political violence and violence of all kinds. But his murder does not justify the dizzying campaign of political repression that has been carried out often in his name since. To exploit his murder, to crush dissent, or to censor speech is unacceptable. And this brings me back to the debate over the expiring budget. I join with my colleagues in wanting this new budget to, at the very least, postpone the healthcare insurance increases that are coming for millions of Americans, that are going to ruin people's lives in this country. 75% increases for people who are going to make this awful decision about whether they should continue to pay their premiums, whether they should put food on the table for their kids, or whether they should risk going without insurance. I think that's a pretty reasonable ask. Just don't increase costs on families when it comes to health care at a time when the cost of everything else is going up because of President Trump's insane economic policies. But let me ask you this as well. Why would we not also simply say that any budget we pass should stop the worst of the lawlessness? Stop the deployments to our cities. Stop the witch hunt of Comey and Soros and Senator Schiff. Stop using the FCC to censor speech. Stop unconstitutionally ignoring the budget and spending only money that the president wants to spend. To me, this is simple. We should not willingly pay the bills for the most serious assault on political freedom since the Civil War, an assault that may collapse American democracy as we know it. Now, I know my Republican friends think that this is hyperbole, that our fear for democracy is just fear-mongering, just politics. I swear it is not. My Republican colleagues know why Comey and Senator Schiff and Soros are being targeted. They know that the president just picked the people that give him the hardest time and told his folks to come up with charges. My Republican colleagues know the impact that this has on people who want to politically and peacefully oppose the president, but now won't do that because they fear for their freedom. Republicans know this. They should not defend it. Republicans know that it's wrong to sit down and agree to a budget and then cheer the president when he refuses to spend the money in blue states or on the priorities that got Democrats to sit down at the table to begin with. Republicans know that that's not fair play. They shouldn't defend it. And Republicans know that using the FCC to crack down on speech that the president doesn't agree with is wrong. They know, as Senator Cruz pointed out, that that's a slippery slope that we may never get off. I want to find agreement with the Republicans on stopping these premiums from going up. I do. I think that's really important for people in this country. And I think it's okay to admit that this is an odd arrangement that we have in American government today, where the minority party in the Senate, so long as it has 40 members, is kind of in a coalition government with the majority party because the budget can't pass without bipartisan agreement. But the majority party has an obligation to honor and fight for a basic set of protections for our democracy. And when it doesn't, it really stops being a good faith negotiating partner. How do Republicans expect us to vote for a budget that funds a government that is lawlessly pursuing Democrats, that is arresting and harassing our members and our allies, that's deploying the army and masked officers to our cities? We are at a moment of decision for this country. Right now, Republicans aren't even trying to keep the government open. They're not even here. They're rooting for a shutdown. But if we're going to keep the government open, why can't we all agree that it should only be a government that respects our democracy, that is not corrupt, that doesn't treat people and places that oppose President Trump as enemies deserving of indictment or military deployment? That also seems like a pretty minimalist ask. So it's decision time. Is this Senate going to fund the destruction of our democracy, or are we going to do what is necessary to stand up for basic American values? I yield the floor.
Recognize the other senator from Connecticut.
Thank you. Well, I'm honored to follow my colleague from Connecticut and to build on some of the arguments that he has made so well. We're here because our democracy is in crisis. It's not some potential catastrophe on the horizon that's distant or hypothetical. It's real. It's now because of the lawlessness and recklessness of this administration. And it is the result of a contempt for the law, for legal norms, that seemingly is boundless. We've seen it in the Jimmy Kimmel episode where the FCC chair said in mobster-like language, they can do it the hard way or the easy way. You have a nice restaurant there, it would be a shame if anything happened to it. I prosecuted mob cases. That's the kind of language we see from organized crime. And it was shown in the indictment of James Comey, a document signed only by the United States Attorney, not by any career official. And after only 14 members of the 23 people on that grand jury voted to do it on 2 of the counts, rejecting a third, all of this kind of procedure is so highly extraordinary. As a former prosecutor, it would be an embarrassment. But this administration is beyond shame when it comes to lawlessness. And we've seen it in immigration, in healthcare, in education, in the VA, where countless people have been illegally fired, some of them hired back. And that is why we are insisting that there be a guarantee that the president will follow the law when we pass a budget. Not a hypothetical danger that he will disobey it. In fact, he's ordered rescissions, impoundments, clawbacks. If we pass a law, we have to be sure the president will follow it. Otherwise, there really isn't any point to this branch of government. And so I say to my Republican colleagues, as a matter of your self-respect, as a matter of protecting this institution, you should agree with us that there must be a guarantee that the rule of law will prevail. And I say to my constituents in Connecticut, we're going to stand up for you to save your health care, because you can't wait to get sick. You don't choose to get sick on November 22nd or January 3rd when it's convenient for Donald Trump and the Republican majority. You need to know when there's open enrollment on November 1 whether or not your insurance will be affordable for you. You need to know whether those subsidies will make it affordable for you, because otherwise you won't be able to buy insurance through the ACA. In fact, 90% of all people in Connecticut who buy insurance through the ACA marketplace receive some kind of subsidy. And their insurance premiums will skyrocket by 75% if that subsidy is ended. They need to know now, when open enrollment starts, whether those subsidies will be there for them. And it will affect insurance premiums for everyone if we fail to extend those subsidies as part of this continuing resolution now. Why? Because healthier people who see their insurance premiums rise by 20%, right now they're projected to rise at least 18% for everyone, because that's the cost of this failure to extend the subsidies. The healthier people are going to say, I'm not bothering, I won't need it. The sicker people may try to buy it, and the insurance companies will have to cover illnesses, more of them with fewer premiums, and they will have to charge more to everyone to cover it. So this failure to do the right thing has impacts for everyone who seeks health care and tries to buy insurance to pay for it. The Republican proposal is an abject failure when it comes to ensuring that the American people don't pay more for health care. And I heard from constituents just over this past weekend as I went to the Durham Fair, as I went to the Mum Parade in Bristol, as I went to Norwalk and Stamford and Milford, all around the state, people asking me, what will happen to my health insurance? What will happen to my health care? Nothing is more important than health. And we are saving health care for the American people by insisting that this extension of government funding include a reversal of the cruel and stupid, big, blatant betrayal. It's not a big, beautiful bill. The big, blatant betrayal that failed to extend those health care subsidies, and insist that whatever the bill that's passed be obeyed by the president. The ACA premium tax credits have protected millions of Americans from those higher health care costs, and they've reduced the number of Americans without health insurance coverage. They've provided robust choices for consumers and provided stability for health care providers, especially in rural areas. And I've heard from those providers who are as worried as their patients about what will happen to this program. What the Republicans are doing is cruel. It's unnecessary. There is a straightforward, simple solution. It should not be a partisan issue. Republicans know we have to extend those subsidies. Why not now? That's the mystery to the American people. And there will be no credit for a shutdown. The American people know that we're not seeking it. We hope to avoid it. It will be on Republicans who have refused to come to the table. House Republicans have refused even to come to town, come back to go into session. And they are having discussions, reportedly, about whether they can have fundraisers during the shutdown if there is one. So we need some wiser heads and stronger consciences to prevail. And I am hopeful there is still time to reach that kind of agreement. I choose to stand with working families, and I urge my Republicans to do the same. Thank you, Mr. President.
Mr. President,
I recognize the Minority Whip.
Mr. President, millions of Americans better check their mailbox the next week or two. There's some bad news. Letters are being sent by health insurance companies that are trying to give some kind of a warning to these families about what's going to happen to their health insurance premiums because of the big, beautiful Trump budget bill. One family in Illinois tells the story. Leanne Safford and her husband, Lori. Right now, Leanne and Lori pay $278 a month for health insurance under the Affordable Care Act. But starting January 1st, their monthly premiums, now get this, jump from $278 a month to $1,800 a month, a 550% increase. $1,500 more coming out of the paychecks of Lori and Leanne. Why is this happening? Because we have a system, or had a system, that provided subsidies and tax credits to working families so that they could afford their health insurance. However, in the big, beautiful budget bill of Donald Trump, passed with every Republican voting for it, every Democrat voting against it, these subsidies and credits started to disappear. Thanks to President Biden and a Democratic Congress, those credits were there for families that they could count on them. Because of the Republican decision with President Trump to give tax breaks to the wealthiest people in America, they cut back on the premium assistance that was available to the Safford family. These credits had opened the door to millions of working and middle-class Americans like Leanne and Lori to be able to afford quality health insurance. Now they've got to make a choice. This is a lot of money. $1,500 a month? Millions of Americans will decide. Are we going to cut back on essentials like food and dental, or switch to a higher deductible plan, more money out of pocket if anybody gets sick? Leanne said, quote, right now we're making a decision based on being relatively healthy. But as we all know, with health, it could change in a day. That's the same bind that millions of Americans are going to face because of the Republican decision to give a tax break to the wealthiest people in America. According to the Congressional Budget Office, more than 4 million American families are going to lose their health insurance if congressional Republicans allow these subsidies to expire. And that's what's going to happen if we don't change, including more than 100,000 in my state of Illinois. It doesn't have to be this way. We can extend these tax credits and still fund government. I remember a time in this chamber when Democrats and Republicans came together on a bipartisan basis when real family challenges existed and tried to solve the problem. We just don't have that spirit here anymore. They've decided on the Republican side we're going to give tax breaks to these wealthy people, even at the expense of working families. And we have a president hell-bent on abusing his power and a Republican Congress that refuse to disagree with him. Earlier this year, President Trump and Republicans in Congress signed into law this big, beautiful bill. Cuts nearly $1 trillion from programs like Medicaid. What is Medicaid important for? Limited income families and retired individuals. This big, beautiful Republican budget bill cuts nearly $1 trillion from Medicaid and $300 billion from the food stamp program, now known as SNAP. As a result of their bill, the Republican bill, more than 10 million Americans will lose their health coverage. Ever had a child who was sick and no health insurance? I have. You'll never forget it as long as you live. This is separate from 4 million others who stand to lose their health coverage if the Republicans continue to block our efforts with the ACA tax credit. It seems Republicans in Congress are fine adding more than $3 trillion to the national debt over the next 10 years to pay for those tax cuts, but they draw the line at extending health care to millions of hardworking Americans. The math is clear. Republicans don't have the votes to force this extreme agenda. Governing requires input from both sides. We're taking a stand for this family and millions more just like them. When they get the jolt of the news of where their health insurance premium is going to go, where do they turn? I hope they can turn to Congress and members of the Senate who actually care for working families. If we refuse to do the job, Leanne and Lori are going to pay the price. Let's be clear. Democrats stand ready to negotiate on a fair, bipartisan basis. The only reason we're staring at this shutdown is because Republicans have refused to come to the table. There was a meeting in the White House today. Don't let it be the last one. Let's come together and fix this health care problem for America's working families. The president on Fox News said last week, don't even bother dealing with the Democrats. Well, the president's wrong. We're in this together. We need to solve this problem together. If the government shuts down, it will be because of President Trump walking away from a major challenge facing working families. I yield the floor.
Recognize the senator from Rhode Island.
Mr. President, one of the things I've had the most trouble understanding in the time that I've been in the Senate has been Republicans' bizarre fascination with attacking healthcare systems, with taking healthcare coverage away from Americans. It came to a boil in the Beautiful for Billionaires bill, which cut about $1 trillion out of Medicaid, and then in a hidden fashion through sequester, cut about $500 billion out of Medicare, and then attacked the Affordable Care Act, which so many Americans rely on to be able to afford their health insurance. I represent Rhode Island. Rhode Island is probably going to lose up to $5 billion in federal Medicaid funding. The Medicare cuts would be probably about half of that. And the Affordable Care Act is going to hit about 40,000 Rhode Islanders who will see their insurance premiums explode. And that is going to happen soon. This is a health care crisis that Republicans have created. And we'd like to try to protect the American public in all of this. These are not going to be small increases in people's bills. We're talking about an 85% increase in already expensive health insurance premiums, as much as $1,200 a year for a middle-class family. Let me give you just an example of what this looks like in real life. A constituent named Carla. Carla's 60 years old. She's retired. She was a mental health counselor, which is noble work, but doesn't make you rich. She gets $60,000 in annual income, mostly from her 401k. She doesn't yet qualify for Medicare, so she got insurance from Rhode Island State Health Insurance Marketplace. She has a family history of heart disease. She has hypertension. When the tax credits under the Affordable Care Act expire at the end of the year, Carla's monthly premium will go from $427 a month to $904 a month. That's more than double. That's a $477 per month increase to the expenses of a woman whose total income is only $60,000 a year. We ought to be able to solve this. All we're asking for is serious negotiations to address the Republican health care crisis. Or, I guess, if they refuse, the Republican government shutdown. It's very much up to Republicans where we go from here. All the reports are that the meeting between the president and congressional leaders went badly. No progress was made at all. It's really up to the Republicans. Will they really choose to shut down the United States government just to indulge their bizarre fascination with taking health care away from Americans? Aren't we better than that? Mr. President, I yield the floor.
Mr. President,
Recognize the senator from Arizona.
Mr. President, we are just a day away from a government shutdown because President Trump and Republicans would rather shut down the government than work with us to keep health care premiums from spiking for American families. We're watching the same pattern repeat itself again in Washington. Partisan politics and dysfunction hurting hard-working families. This fight, Mr. President, is about health care. It's about what happens to families in Arizona if tax credits that reduce their health care premiums expire. It's about costs going up for people who are already feeling squeezed by inflation and Trump's tariffs, driving up the prices of everything, from groceries to back-to-school supplies. And it's not complicated. If these tax credits expire, working families in my state will see their monthly premiums spike when they go up to sign up for a new plan in just a few weeks. I've heard from Arizonans who are now saving hundreds of dollars every month because of these credits. Ending them would be a gut punch. For some, it would mean losing their coverage altogether. So it's pretty simple. We should extend them, and that's what we're proposing. And let's not forget who holds the cards. Donald Trump and my Republican colleagues. They're the ones saying no, not just to Democrats, not just to us, but to families in Arizona and across the country. But instead of working with us to lower costs and avoid a shutdown, Donald Trump has refused to even sit down and talk about it for weeks until just today, barely 24 hours before the deadline. He'd rather watch the country inch closer to a shutdown than to try to figure out solutions. And Mr. President, it's going to be everyday Americans who pay the price, your constituents and mine. In Arizona, more than 379,000 people have reduced premiums through these tax credits. It lowers their premium by, on average, about $475 every single month. So if those tax credits are allowed to expire, that means their health care premiums for next year go up as much as 55%. That's hundreds of dollars every single month. And that blows a huge hole in the family budget. It means canceled family trips. It means not being able to sign your kid up to a sports league. It means taking on more shifts just to cover this added cost. And for a lot of folks, what this means, it means they will not be able to afford health insurance at all. The estimate is that more than 109,000 people in Arizona alone would be unable to afford coverage. In the richest country in the history of the world, there is no reason why somebody who is working full-time shouldn't be able to afford basic health insurance. No one should be one accident or one unexpected illness away from financial ruin. No one should be unable to take their kid to a doctor when they get sick. But here we are because of Donald Trump and Republicans. This would hurt even harder in rural Arizona and small towns, places like Cochise, Apache, Navajo, and Santa Cruz counties, where there are fewer large employers who offer health benefits, but these are counties with higher poverty rates. It will hurt families across Arizona who finally got access to care. And now they're being told that it may disappear. It doesn't have to be this way. Now, there's still time to extend the premium tax credits and protect families from higher costs while keeping the federal government open and serving Americans. Mr. President, we can do this. We've just got to be willing to sit down and work to figure it out. I know I am. Thank you, and I yield the floor.
Recognize the senator from Wisconsin.
I'll note we're running a little bit behind schedule, so I'll ask consent to be able to speak up to 25 minutes before taking the vote.
Without objection.
Mr. President, I'll ask everybody in the chamber, everybody listening to me on C-SPAN, aren't you getting sick and tired of these government shutdown showdowns? The drama, the turmoil,